What's up, beautiful people? It's your Ate again. For today's video, I will share to you some of the things that I learned here in Canada as an immigrant radiographer. Why is this my video? Because I just realized that today is our second year here, and because of that, I want to share to you the 7 things that I learned as an immigrant radiographer here in Canada. Again, 7 things only, so keep watching the whole video because whether you'll be coming here as a permanent resident, temporary foreign worker, tourist visa, or whether you'll be working here as a radiographer or not, one thing is for sure, you'll experience 1 or 2 things that I will mention in this video. So as usual, don't forget to like, subscribe, share, and comment if you like this video. Are you ready? Ready or not, here we go. The first thing that I learned is being culturally competent. As we all know, Canada is a diverse country, and so don't get surprised if you'll encounter patients from different walks of life. You'll encounter a diverse range of people due to its multicultural society, and some of their personalities, attitude, or character may not be pleasing to your eyes, and that's why instead of judging them or getting angry at them, have an open mind. This also eliminates or lessens any prejudices or stereotypes we have for others. In my case, I prepared myself by joining a course about Canadian healthcare, and while I know for myself it isn't enough and that I still have a lot of things to learn, somehow it helped me have an idea of what to expect here. In my experience too as a radiographer here, I have x-rayed people from the First Nations or Indigenous, other immigrants, French and English Canadians. I worked also with people from various cultural backgrounds such as South Asians, Chinese, Middle Eastern, Africans, Southeast Asians, and many more. You will also notice that there are lots of students and academics here, which adds to the country's educational cultural landscape. And finally, there's the refugees. So overall, the ethnicity, cultural, and linguistic backgrounds of Canada is very diverse. And if you're able to adapt to a diverse population, it will be easy for you to effectively communicate with people from various backgrounds. The second one is you have to learn the structure and certification process of the regulatory processes here. For instance, how to acquire a license or certificates from the Canadian Association of Medical Radiation Technologists, or CAMRT. I have met a lot of people who rushed their immigration journey here because they thought that life inside Canada is easy, only to find out that it is not, and so by the time they realize the difficulty, it's already too late for some of them because they could not prepare the necessary documents to get their license, or that they have already spent so much money on other pathways that they're afraid to spend money again. So ladies and gentlemen, don't rush your journey here. Focus on studying on how to obtain your CAMRT license by reading and visiting their website, or watch YouTube tutorials like mine. And don't worry about information overload because if you keep reading them every day, eventually you'll understand the process. The third one is you must get acquainted to the healthcare system here. Canada's healthcare system is publicly funded through the taxes of people, and the coverage is universal, which means that Canadian citizens and permanent residents get access to medical, hospital, and physician services without direct charge during the point of care. However, you also have to know that while the system covers the necessary medical services, provinces and territories may have different levels of coverage for services such as prescription drugs, dental care, and vision care, and they might be only covered if you have a private insurance or if you shell out money from your pocket. This is one of the things we learned in our first few months here, so if you're not yet here, research the province that will not require you to pay monthly fees for your spouse or dependents, because that's also a lot of money, or do try to weigh which province charges you less. Research also its structure, policies, and even the role of radiologic technology here. The fourth thing that I learned in my 2 years here is what's the workplace norms, or what's the normal or typical workplace. Before coming here, I have been with different employers, and so I thought that I've already seen the worst of the worst people, not to mention that I've also worked abroad, so I thought that I've already prepared myself from all the toxicity and traumas out there, but boy was I wrong. Canadian personalities and characters are also different. There are those who are chill at work, life of the party, easy to work with, and approachable, to name a few. But there are also those who are hypercritical, perfectionist, doesn't like to carry their own weight, not a good team player, and so on and so forth. That's why if you always think that they are friendly, which is only a stereotype, don't get discouraged. By the way, most of them are friendly, but they are rough around the edges. Anyhow, if you have friends who are already here, talk to them and ask what's life at work, and don't get discouraged if they'll say negative things about Canada, because this isn't a perfect country and we're not perfect people too. Instead, learn from it and adjust and hope for the best. Don't expect your workplace to be better than your previous workplace too, because it might not be. Another workplace norms is communication. Be prepared with your English here, because as an X-ray technologist, we always communicate with the patients, and there are people here who won't hesitate to tell you that they can't understand your accent. So my tip is to always talk loudly to them and be assertive all the time, so you're always leading the conversation. Otherwise, they're going to belittle you. Teamwork is also important here, because you'll be working with different healthcare from different departments, so don't be afraid to ask help from them, for example, if you need help with lifting the patient. Otherwise, if something goes wrong, they will question you why you didn't ask for help. So again, be assertive but respectful. Lastly, I'm sure that some of you have already heard of stories that it is an edge for you if you have a Canadian experience, because you'll get hired here easily compared to those people who doesn't have one, and that is true. So don't be afraid to volunteer during your free time or study again, because the more you have an education or the more you get acquainted to people, the more also you'll find better opportunities suited for you instead of just being stagnant. However, even so with this, there are still people out there who doesn't have a Canadian experience but were still able to get a job here. I believe that the good thing about having a Canadian experience, especially if you aim to work in the healthcare industry, is that you are already familiar to the Canadian healthcare system. The fifth one that I want to share to you is the financial management. Of course, if you're an immigrant, most of you will bring a lot of money to survive for the months of no job here. While there are a few of you who will only bring enough money because they think that they can just get a job here easily, but truth be told, after pandemic, everything started to change here, and just like in your country, some of the prices here never went back to its usual price, so getting a job here is no longer easy like it used to be. Hence, what I learned is to always familiarize the cost of living of your chosen province or town, such as the cost of housing or rental houses options. In Canada, it is cheaper to live in rural areas compared to cities, but there are more transportation options in the city than in the rural areas. Check also your utilities. The more people living in the house, the more your utilities will go high, especially during the winter season. Then there's the monthly grocery bills. By aiming for a specific budget every month and lessening also your restaurant trips, you can surely save a lot of money on this one too. Decide also if whether you want to get a car or you just use the public transportation, because owning a car comes with associated costs like insurance, maintenance, and not to mention the expensive fuel here. However, if you live in a rural area and you can't walk to your job, then owning a car is a much better option, because you don't want to freeze in the cold out there to you. Then there's leisure activities here too. Every season there are activities or sports that you can always join, but remember that the equipment or gears can also be very pricey, so take this one in your financial budget too. Remember that once you leave the house, that's when the money will also start leaving your pockets too. It's always best to make friends here who has experience in financial management or who's not a spender, because you can really save a lot of money if you hang out with them. Number 6 is that I have learned to deal with the challenges of integrating into a new healthcare system and have adapted to different work environments and patient care models. Immigrating to another country is difficult already, but adjusting to a new work environment is also another level of difficulty. I do not know if it's just here in Canada or maybe it's just a workplace norms, but once they know that you already have a previous work experience of your job, regardless if you're new in Canada or not, they will already treat you as someone who has worked in their department for ages already, so expect that orientation will be a lot different from the usual orientation you are accustomed to in your own country. You will also be reading a lot, because most of the time the information here are not spoon-feed, meaning to say it is self-learned. You want to know how to calibrate the machine? Read this. Or do you want to know the protocols of this department? Read that. Or do you want to know your right as a union? Read this again. Things like that, for example. I am not saying that you won't get help. Of course, you still will, especially if you ask them from your department head, but the help is only like a brush off. The rest will still be up to you, of course. If you're new here, especially in the healthcare industry, prepare yourself for information overload. The good side, though, is that Canada is all about work-life balance. Canadians really prioritize a balance between their professional and personal lives. That's why, aside from physical health, mental health is also important. And people here really benefit from generous vacations, public holidays, and family leave policies. In my experience so far, Canadian workplaces often strive to encourage a supportive and balanced environment with a focus on employee well-being and equality. And I think for me that's important because this is something that some of us have not experienced so far in our previous employment. The last but not the least is being resilient. Yes, dear, you heard it right. Resiliency is the key. Whatever challenges you'll have here, whether it would be language barriers, finding employment, adjusting to your work environments, acclimating to your newfound place, cold climate, or even establishing your social network, know that all of these challenges can build strength and perseverance. And believe it or not, in my case, my challenges helped me combat the seasonal depression here and even anxiety because I had no choice back then but to find solutions to my problems. And I really didn't have enough time to entertain mental health issues because my plate was already full that time. And now when I look back to my first few months here, all I could say is that I am glad I had those problems and I persevered. Also, don't listen or watch the negative news and always channel your energy to the positive things because before you know it, you're already a permanent resident here. Whew! Dumugo ang ilong niyo, no? Charing! Those are just a few things that I believe are the most important things that I learned here and want to share to you. There are still more, but I think those 7 for me are the ones that really struck me the most. Do other people have similar experiences to mine? I don't know, but I'm pretty sure that just like me, they also had their own share of challenges that they had to deal with, but they overcame it eventually. How about you? What's your immigrant story so far? Share it down in the comment section below so other people can have an idea too. Remember that all good hard work always pays off. See you in my next vlog. Paalam.